Hi everyone, my name is Abby Flores. I'm your student test for today. I'm from Piermar, Pamantasan, Luzon, naman. I'm going to perform female catheterization. I'm going to assist the clients needs for catheterization, and I'm going to review clients' medical records or any medical pathological condition. I'm going to ask the patient or check the patient if having a allergies or something like symptoms of health condition or something wrong in the health of my patient. And I'm going to introduce myself in my patient and identify the patient, which is I'm going to explain why it's necessary and what I'm going to do in this procedure. Hi ma'am, my name is Alvin Flores. I'm your student nurse for today. I'm from Pialmar, Pamantasan, Luzon, Marikina. Is it with you? I'm going to do the procedure with you. Okay, thank you. The next is I'm going to provide privacy for my patient. So this is a confidential situation. So I'm going to provide privacy. And then the next procedures is I'm going to all prepare the materials what we need. Okay. The next is I'm going to perform hand hygiene. Because hand hygiene is prevent cross contamination. So the next is I'm going to ask the patient or provide appropriate position, which is the supine position. I'm going to ask the patient bend her knees to easily do the procedure. And hi ma'am, my name is Albert Flores. I'm going to bend your knees. Can you please bend? Okay, let's assume that the patient bend her knees. Okay. The next is I'm going to raise the bed with a good condition or with a good position. Okay. The next is I'm going to apply sterile in the entire procedure because this entire sterile procedure preventing cross contamination and giving a bacteria or germs that I handle all the things all my materials. Okay. So the next is I'm going to establish adequate lighting. If you are right-handed, you need to position yourself in the right side of the client. If you are left-handed, you need to position yourself in the left side of the patient. Okay. The next is I'm going to open the catheterization kit. This is the catheterization kit. If you can see this is sealed and cannot be used. Use this one. So we need to open this because all these equipments inside is what we needed in this procedure. Okay. This plastic is I'm going to put this one in this trash can. So the next I'm going to wear gloves, which is the sterile gloves. Let's assume this is a sterile gloves, so I don't have it. So let's assume this is the sterile gloves. Okay. You need to apply all the sterile techniques the entire procedure. Okay. To prevent cross contamination or giving a bacteria, because this procedure is cannot be easily do the procedure because if the procedure is highly all the time that using this, the more spending time in this procedure, the more getting highly chances of getting a bacteria or cross contamination because the air giving a virus. Okay. So this is the glove, a sterile glove. So let's assume this is the sterile gloves because the sterile gloves is preventing cross-contamination, and also giving a good and safety procedure. And this one, this is the um, urinary drapes. Okay, this is the urinary drapes. You need to position this to protect the urethra, okay, of the patient. This one of the position is can use this in these legs to easily do the procedure of the female catheterization. And the other hand, in this one also using um this cat is using for easily wide the legs of the position of the patient. Okay, and the next is this is the if you can see, this is the rectangle, or maybe this is the shapes of just like open space, this one to use to be easily do the procedure. And this is the one who protect the entire procedure in the urethra. Okay, so let's assume this is the we need betadine. Okay, betadine, some 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 cotton balls. Let's assume this is the cleaning distilled water. So then this is the 10 cc of syringe that we need. Okay, the next is this is the urinary bag. Okay, and this is the important equipment what we need. Okay, this is the urinary. Naputol mo dyan eh. I'm sorry, I'm going to correct my called in this. This is the sterile drapes. This one. This is the sterile drapes to protect the entire procedure of the patient. Okay. The next is this is the urinary catheter. This is the important, and this is the use in the catheterization. Okay. So first, I'm going to clean all the inside in the urethra in this one. Okay, you need to clean this before you put the urinary catheter. Let us assume this is the you need this because you don't you ever use your hand to clean the urethra, the part of the urethra of the position of the patient. Okay, so you need to put some betadine in the cotton balls. Let's assume I put some betadine. Okay. The next is you need to just like this. Okay. Okay. To clean outside is like this. Okay. This procedure giving a safety and preventing can be preventing a put some bacteria, and you need to clean this before you put the urinary catheter. And if you are put urinary catheter, you need to secure and also know what is the important it is, okay? So let assume I'm done. So the next is I'm going to um what is that? I'm going to check. I'm going to check if the urinary catheters is blow, just like a circle in this part, okay? If I put some water inside in this catheter and it's automatically locked here, okay? If some put with catheter or water in this, it's like this, okay? Okay, let's assume this is automatically locked in this catheter, you know, and um, okay. So the next is I'm going to place the urinary bag. Okay, this is the urinary bag. Okay, in this one, because you need this procedures with we getting the urine from the bladder of the patient. You need to use this procedure to get the urine, okay? The urine on the bladder of the patient, okay? It's like this. So this one, okay? Let's assume this is I put in here in this procedure. Okay. Okay. Thus the next is I'm going to put here some this one. I'm going to shoot or maybe insert this urinary catheter inside the urethra of the patient, okay? You need to slow or giving a water this one, okay? Okay, I'm done. So this urinary bag is used to be put the urine of the patient, and this is the tube. This is the tube that um, flow inside in the urinary bag. So okay, we need to, and the next is I'm going to um, arrange or maybe um, put this one just like this, okay? And all the materials you use, you need to discard and put in the trash can. This one, and so the next is I'm going to um, um, clean, okay? Okay, and remove the sterile drapes and put in the trash can, okay? And this procedure is we need to concentrate and be confidential in this procedure, and I'm going to remove my gloves. remove my gloves, just like this, okay? And put in the trash can. And I'm going to document all the procedures that I aim in this procedure. So again, my name is Alvo Flores. I'm your student nurse for today. So I'm Prialmar Pamantasan ng Lungsod ng Marikina. Okay. Everyone, my name is Alvo Flores. I'm your student nurse for today. So I'm from Prialmar Pamantasan ng Lungsod ng Marikina. So I'm going to verify doctor's order in my patient and to read what is the condition of the patient. The next is I'm going to prepare all the materials what we needed. The materials what we needed is nasal cannula and simple face mask. And also we need the materials is are maybe the flow meter and also the tape cannula and also the modifier cap or the modifier pattern. Okay. The next is I'm going to provide privacy for my patient and also I'm going to explain why it's necessary and what I'm going to do and hand washing because the hand washing is prevent cross contamination to my patient and me. Cannot imagine. I'm going to set up the oxygen equipment and also the humidifier. Okay, this is the oxygen equipment that we needed, and also this is this is the modifier or the modifier bottle. Okay. Let assume that I don't have a modifier bottle, but I have a prepared cup here. Then I'm going to fill the modifier or the fill the modifier what is the base on the meter, which is this is the flow meter. This is the flow meter that based on the flow meter is going to correct the dosage of the flowing of the air or the flowing of the giving the by the patient. Okay. Let us put the flow meter in the oxygen tank. Okay, that one. Okay. The next is I'm going to fill the humidifier cup in the fill the modifier bottles based on the rate of the meter. Okay. For example, if the rate of the flow meter is in the middle, so you need to put the water, the distilled water, if needed. Okay, if needed or if needed in this procedure. So you need to put some distilled water in the modifier. So this is the modifier cup, and also let us show that I put some distilled water if needed. Okay. Let's put the modifier cup or the modifier bottle in the oxygen tank. Just like this. Okay. And also attach the prescribed oxygen tubing and the description of the modifiers. And also I'm going to provide or maybe attach again to check the prescribed of orders in the oxygen tank and also in the flow. And don't forget to turn on the oxygen. Okay. The next is I'm going to check all the check if the flow rate order of the oxygen and set the oxygen tubing by delivery device to the verifier. Okay. The next, I'm going to turn on the oxygen what is prescribed, the orders of the oxygen. Okay. Just like this. So let's assume that I open this. Okay. Then next, I'm going to uh, check if the oxygen's freely flowing in the tubing, and also check also the orders or oxygen orders or prescribed orders in the oxygen tank. Okay. First, the oxygen tank is used in the hospitals when you um, difficulty in breathing, and also you need to confine in the hospital. And this flow meters is used for check and correctness of the um, flowing of the. So this one like this, I'm going to show what is the purpose of the nasal cannula. So if you can see, I'm using this one to use in the way of the air to lock the national cannula to easily to produce or to prevent the entire procedure of the nasal cannula. So I'm going to put here the national cannula. Okay, so you need to lock the nasal cannula in the ear so that to easily to put the national cannula in the patient. So if you can see, this is the locking of the nasal cannula. Okay, so you use this one to lock the nasal cannula in the patient. Okay, if needed. Just like this, okay? So, this one you need to put here in the humidifier or the modifier bottle. Just like this, okay? Let's assume that I put it here, okay? The next is, I'm going to discard this one because I'm done in the national cannula. So, the next is, I'm going to I forgot if the patient can stay the national cannula in her face, so you need to use tape cannula. So let's assume that I have a tape cannula. So this is the tape cannula. You need to put in here side by side to stay the nasal cannula in her face to give good condition and good procedure. The next is I'm going to provide again the simple face mask. So what is the simple face mask? The simple face mask is highly recommended, which is highly high concentration and high oxygen, that which is providing a 6 to 10 liters per minute. So this one, okay, this is the simple face mask. So let us show this is the simple face mask. Okay. We use this simple face mask to the patient that difficult breathing. Okay. So you need to fit the mask in the client's face and the client face or the patient's face, and also you need to just like this. So let us show this is the simple face mask. So this one is the tubing or the tube. By using this one, the air going throughout the mouth of the nose of the patient, and this is one you put here in the modifier bottle, and to use for easily breathing, and this one is used for difficulty breathing of the patient, and this one is going to provide a simple face mask is the pad tubing in the patient, and also the clients gain use the simple face mask gain successful breathing in herself. And if you can see, there are um, what's called that circle in here. Let us show that circle in here, and this is um, help the patient easily breathe in the simple face mask. So again, I'm going to hand hygiene or prepare the hand hygiene, because perform hand hygiene is very important to us, and this is one of the important precautions in the world, and this is preventing microorganism prevent microorganism to transfer in the my patient and me. And also we need to document all the procedures, and the documentation in this procedure is the patient is low risk, which is um, she can use the nasal cannula because she shortly difficult breathing, and and she cannot use the simple face mask because she doesn't not have a difficulty of breathing, just like high presentation of history. Okay. Again, my name is Al Flores. I'm your student for today. I'm from PMR, Pamantasan, Luzon, Marikina. So, thank you.